Spinal cord tumors are dangerous. And the surgery for spinal cord tumors is difficult. So, in the recent times, there are many new technologies which help us surgeons in removing the spinal cord tumors effectively and safely. One such equipment which is useful for surgical removal of intramedullary spinal cord tumors is an ultrasonic aspirator. I'm Dr. Kalyan. I'm a neurosurgeon and spine surgeon. In this episode, I will be telling you what is an ultrasonic aspirator, how is it useful in surgery for spinal cord tumors, particularly spinal cord tumors like ependymoma. So let's discuss about ultrasonic aspirator in spinal cord ependymoma or astrocytoma surgery. So let's speak about ultrasonic aspirator in spinal cord tumor like ependymoma or astrocytoma. What is this ultrasonic aspirator? How is it useful? How will it increase the efficiency and the safety margin? First, a brief introduction regarding what is spinal cord ependymoma. So ependymoma is a type of spinal cord tumor that arises from the ependymal cells. So what are these ependymal cells? You see the spinal cord. In the center of the spinal cord is the central canal. The cells lining the central canal are called ependymal cells, and a tumor arising from these ependymal cells is called an ependymoma. So this is an example of the cervical cord ependymoma. So where does they arise? They can arise at various levels of the spinal cord, including the cervical region, the thoracic region, and the lumbar region. And what are their characteristics? They are typically slow-growing tumors. They compress the spinal cord and cause neurological symptoms. And now, what is an ultrasonic aspirator? So this is a typical ultrasonic aspirator which we use in our setup in our hospital. So ultrasonic aspirator is a surgical tool that uses ultrasonic energy to fragment and remove the tumor tissue. So how does it function? It pulverizes, it breaks down the tumor tissue into smaller pieces which can then be aspirated or suctioned out. The ultrasonic aspirators offer precise tissue removal, tissue preservation, and can be used in minimally invasive approaches. So basically, ultrasonic aspirator is a combination of three surgical things. It has a ultrasonic pulverizer. So there is an ultrasonic material in it. Second one, there is an irrigation cannula which continuously irrigates the operative field with saline. So there is an irrigation cannula. And third is an aspiration channel. So the small pieces of the tumor. So how this happens? This ultrasonic portion breaks the tumor tissue into smaller pieces. This irrigation channel continuously pours water into it, so that this forms something like a easily suckable tissue, and this aspirator sucks that tissue. Let's go. So first portion was the ultrasonic one, which pulverizes the tissue. So just let's see an animation. So this is my ultrasonic aspirator. See, this is breaking the tumor tissue into small pieces. This is the primary function of the ultrasonic aspirator. So the ultrasonic aspirators are effective in debulking or removing tumor tissue. Let's go back again. See, let's see. We'll try to say it again. Okay, let's see this video again. So the ultrasound, see from here, it's breaking down the tissue into small pieces, very small. It pulverizes the tissue. This is the function of the ultrasonic portion of the ultrasonic aspirator. So the ultrasonic aspirators that effective in debulking are removing tumor tissue from the spinal cord. How do they do it? ultrasonic energy, which is emitted by the aspirator, helps to break down the tumor, allowing for the precise removal while minimizing damage to the healthy tissue. It also helps in tissue preservation. Let's see this video. So, the ultrasonic aspirator is more dangerous for the tumor, and it is less dangerous for the spinal nerves, less dangerous for the blood vessels, less dangerous for the spinal cord. So when it comes, let's see. So when we are near the tumor is being destroyed, but the vessels and the nerves are relatively more resistant. Try to understand here. They are relatively more resistant. What does this mean? So how do they preserve? So preservation of normal tissue and neural structures is crucial in spinal cord tumor surgery. This is obvious. So the ultrasonic aspirators selectively target and remove tumor tissue while preserving the normal healthy tissue. They are more selective for the tumor tissue and they preserve the normal healthy tissue. Blood vessels and healthy tissues are usually more resistant to ultrasonic aspirator and thus increasing the safety margin. But I've told you this function is not absolute. That is, if you apply more pressure, if you are not experienced, you can damage the blood vessels, you can damage the nerves, you can damage the spinal cord with the ultrasonic aspirator. So even though ultrasonic aspirator increases the margin of safety, it doesn't mean that you cannot injure the normal tissue. So a surgeon with proper experience, proper expertise, proper training can use this machine to minimize the damage to the surrounding tissues. Next comment. Precision. Because the probe of ultrasonic aspirator is very sleek, it can help in precise tissue removal, which is critical in spinal cord surgery to avoid damage to surrounding tissues. They provide controlled tissue removal, and because the probe is very sleek, it is useful in minimally invasive approaches. They are versatile and can be used in various surgical approaches, making them suitable for different types of spinal cord tumors, including ependymoma. In this picture, you can see we have made a small hole. Through this small hole, you are applying the ultrasonic aspirator and thus achieving our goal. As I have told you, the ultrasonic aspirator is a valuable tool. I can give an example. Even if you are traveling a Mercedes or a big car, even though it's more safer than smaller cars, but still the experience of the driver counts. So similarly, the ultrasonic aspirator should be performed by experienced surgeons who are well versed in their appropriate usage and safety precautions. Ultrasonic aspirators are valuable tools in spinal cord tumor surgery, including for ependymoma, providing precise tissue removal, precise tumor resection, tissue preservation, and also it provides versatility. Thank you. So, hope I have explained very clearly what is an ultrasonic aspirator, the use, whether your operation has been done with ultrasonic aspirator or without, it makes a difference. Ultrasonic aspirators increases the safety margin. If you have any doubts regarding spinal cord tumors, WhatsApp on the number which is being scrolled below. If you like this channel, subscribe to it and do share this video with your friends, colleagues, cousins who are suffering from spinal cord tumors. Thank you for the day.